we're aging. Now we're like in our 50s, or we're moving up, and we talk about the environmental stressors of our life, the visible, what happens, wrinkles start to happen, but there's so much more going on as we age. The aging face, as in our 20s to our
process. Yes.
Tell us, kind of take us through what's
Yes,
happening.
we can actually take a look. There's a slide of an aging face, and on the left you will see a younger face, and on the right you see the older face. What happens is underneath the skin you're getting structural changes. Unfortunately, we all get bone remodeling, bone regression, muscle atrophy, fat shifting, so we lose fat from the cheek area, the temple areas, and the loss of all these underlying structures, the skin loses its support. It's almost like the skin has scaffolding holding it up, and then as you lose this, the skin begins to fall, or you see slacking in the skin. Okay. And this can be replaced. Volume replacement is a very big thing nowadays. We have a second slide showing a filler treatment, and this particular filler treatment that was used for this patient was Sculptra, which is one of many fillers on the market now. And what you're doing with the fillers is really you want to replace that volume loss.
Volume lost. But if I'm hearing you correctly, it also stimulates your existing collagen?
Yes, a lot of the Sculptra in particular is an excellent filler for stimulating your own collagen.
Wow.
This type of filler needs a few sessions. They're usually spaced 6 to 8 weeks apart, and it forces your fibroblasts. These are the cells that make collagen at different levels, in the muscular level, in the skin. It forces collagen production, and it causes thickening in the skin and underneath. There's great volume replacement. There are other fillers too. The hyaluronic acids are very popular too, like Juvederm and Restylane. Those are excellent for filling nasolabial folds. Those are the parentheses people talk about. That is a sugar gel. It's safe. A lot of these products, actually all these products that are on the market now, like the Radius, the Sculptra, the Juvederm, Restylane, they do not need testing. They're pretty safe. They're all safe. The Restylane, Juvederm, hyaluronic acids, you can fill your parentheses line. Even something like that can stimulate a little bit of collagen production, because sometimes the mechanical stress from injecting the product into the skin can stimulate your skin to make collagen. Wow. So we have a lot of patients actually who, after they receive treatment and after the product wears off, come back and say, wow, I look better than when I started, because I think your own body will make a little collagen even with some of the other fillers.
Wow. Okay.
Right. So
that's great.
It's not like Botox, because you seem like you do your, depending on how many treatments you use, once you're done, I mean, it lasts.
It lasts longer. They do last longer. The hyaluronic acids like Restylane, Juvederm can last anywhere from 6 months plus. The Radius, which is a little more robust, can last twice as long as hyaluronic acid, and the Sculptra can give you a couple of years.
Okay.
Wow.
Yeah, they're nice things to try. If anyone has an interest, it is great to, it's also easier to start off when you have early changes, because you need less product.
Right,
So it'll cost less. And if you, along the way, you fill here and there a little bit, it's easier to maintain. But again, even if you have advanced volume loss, that's also replaceable.
Okay.
It just requires more product.
Now, sorry, I have to ask you, ballpark, in terms of money, just...
It depends, again, on the amount of product you purchase. Some of the hyaluronic acids come in smaller syringes. Maybe someone wants to come and just augment the lip a little bit in some of the lip lines. Something like that would run about $350. Otherwise, these fillers can run anywhere, like Restylane, Juvederm, Radius, they can run anywhere from like $650 to $750. Sculptra can run, depending again where you are. You could be from Manhattan all the way up to, northern New York. It could run anywhere from $750 to under $1,000 for a vial.
Okay.
So again, it depends on where you are, the amount of product you need, the type of product you're purchasing.
And I'm not sure if we've mentioned, is there does it hurt? Downtime? You know, can I do this on my lunch break and then go to work?
The nice thing about these fillers, like especially now with the Restylane Juvederm, they come with numbing medicine added in the product. Oh, the sculptor is also mixed with numbing medicine. It's very comfortable. Most people will apply ice packs to the skin, apply a little numbing cream. It should be pretty comfortable. There can be swelling. Some people walk out, they look great. Some people have a little swelling that they'll hold on to for a few days. If you're an aspirin, Advil, Motrin user, you are more likely to bruise. If you bruise, you'd have to hide it with a little makeup. For the most part, people look good within a day or two. Again, but if you bruise, if you tend to get more swelling, maybe you need a few more days. But it's a very comfortable thing that can be done in the office in, under half an hour.